I'm Nate Frink. I am the Hospital Medicine Director for the St. Joseph's Hospital Medicine Service here. I've been here since 2005, and just shortly after the hospital medicine group started, we have grown from just having one doc on every day to now we have 4 rounders every day, and we run a census of 40 to 60 patients a day. We have a huge variety of patients. There's a fairly high case mix index here at St. Joe's, and we have great staff. The nurses here stay here a long time. There's very little turnover on the staff, and so the nurses are great to work with because they have a lot of experience. So it's a great program overall. The culture here is just everybody seems to enjoy coming to work, and they like working with people here. We have it's a faith-based organization, and it's a physician-friendly organization, and it's not your typical, probably real top-down, I think, organization. I think a lot of people really like that, where they can come to work and have a lot of input, and people find that they can impact processes and certainly impact patients' lives. And there's a lot of fulfillment that you get out of doing something like that. So I'm sitting on a number of committees. We have a kind of a discharge SWAT group that meets every couple of weeks with a patient care exec and the nursing director and our medical director for the hospital and the social care management director, and we kind of sit every couple of weeks and discuss just any hot button issues that are going on with trying to figure out ways to get patients the appropriate care that they need in an efficient manner, and so that their admission and the discharge all works well, those kinds of things. We certainly encourage as much physician involvement in the committee work and the just daily functional work in the hospital as possible, because we believe that physicians are kind of key to figuring out better ways to care for patients, and so there is lots of opportunity for involvement in that way, and there's a lot of, I think, fulfillment that you get and satisfaction that you get out of that. And Health East does try to make sure that we match the market salary-wise, and so I think we do a pretty good job of that. And then they will pay for committee work and that kind of thing. So it's not just the fulfillment you get; you do get some, compensation for it, and that helps. But really, it's Health East is a lot about relationships, and you can as you get into the Health East culture, it's about figuring out ways and learning how to relate to people and building great relationships. There's a lot of great people here that work here, and they come here because specifically of the culture here that's here, and we have great employee satisfaction, employee engagement. We have some of the highest scores around in the country if you look at Gallup surveys and that kind of thing, and that's a very nice place to come to work.